Then Adho Mukhena Shayana, should not lie in prone position, they have mentioned. It causes Shodorodha and all. Divanidram Vivarji, as Divanidram causes Kapha Adhikyam, so it should be avoided. Abadhi Viharas in case of Nasa Roga, again Divaswapnam, there will be Kapha Vittavritti. Snanam, Kledavritti, Krodam, Vittavritti. Vegarodha I will mention later. Umishaya. Umishaya means lying on the floor. All these are which may cause Pada Pragopa. All these are contraindicated in Nasa Roga. Again in Shiro Rogam, Anjanam. Here Anjanam mainly Tikshna Anjana Prayoga is mentioned. Danda Kashtam, Dandadhara. If he is having severe pain, like Ardhava Bhedagam and all, there of course small amount of movement also will cause severe pain, intensity may increase. Diva Nidram should not be done in Shiroyoga. So these are all references from Bhaishya Ratnavali. Now why I kept the Vegarodha last is because in all the Karnanas, in all Nidanas, Vegarodha is important. Why? Because we have a lot of references in Vegarodha compared to sense organs. First one is Adhovada. Adhovada, flatus. Adhovadasya rodina gulmodavarta duklamaha. There Drishti Agnivadam is told. Drishti Agnivadam means it is not good for Drishti, not good for Agni. Okay. Why? Because Agni is important for proper maintenance of sense organs, as I told earlier. Another reference is Shagrad Vegarodha causes Pradishyayam Shirorik, which is practically we can see also. Usually in a case of severe headache. It was a case of severe headache. And when we take the history, when we took the history, she was having severe constipation. That is Abana Vaigunyam, Abana Vilomana, Abana Vayu Vilomana is hampered. And this Abana Vayu undergo Pradiloma Gati and causing Sthana Samshrayam Shirobhaga. So here we have to understand the process going inside the body. Why the Pradiloma Vayu resulted in Shiroroga, not in Gulma or abdominal pain. This is because for a Nidana or for a dosha undergoing Dushti, to get Adhishtidam in a certain area, that area should be also less immune or should be weak. For example, this Pradiloma Vayu went and caused Shiroruk. Why? Because the lady was taking bath during midday time. This was the case we had in our OP with presenting a Shiroruk. She every day she take head bath in midday time. Of course, the integrity of the tissues in that area will be lost. And at that time, she also had the problem of constipation. So this Pradiloma Vayu went and got Adhishtita or Sthana Samshrayam Shiras causing Shiroruk. It didn't cause Pradishyayam. If Pradishyayam, again, there will be another Nidanas pertaining to Nasa Roga, Nidana Sevana pertaining to causing Nasa Roga. Then it was Pradishyayam. That's all. So here, the major treatment which we gave was only Virejana actually. For Shiroruk, a Virejana was given with Gandharvasta. She was okay. So that much importance we have when we assess the Vegarodha. So proper history taking is very important when we see the sense organs also, mainly regarding the Koshta. You should consider the Koshta and Shodhana Karma. Then Shavadu Vegarodha. Again, it can cause Shiroyuk and Indriya Daurbalyam due to Shrodorodha occurring in this condition. Krishna Vegarodha, Vadadikyam causes Badhityam in long term. Bashparodham, it may result in Peenasam, Akshi Shiroruk. Bashpa means crying actually. Nidra Vegarodha causes Akshi Gaurav. Everybody knows. So, that is about Vegarodha. So, when we go through all these points, at some point of time, we will feel that why does all these causes diseases always? Nothing, no, right? We are not, even though we are not undergoing any dinacharya activities, still we are healthy, right? So these all affect in long term only, because when we are healthy, these won't show any diseases. So when we are less immune only, these all will. So these are the Apadhya and Padhya Viharas. Now moving on to the Padhya Ahara Prayogas. Padhya Padhya Aharas. So what is Padhya Padhya? Padhyam Padho Anabedam Yadyachokta Manasapayam Yachaprim Apathyam Cha Niyadam Tandalakshri. So a Padhya Dravya or Padhya Ahara, it should be conducive to the Shrodas as well as to Manas. As we know, to be swastha, we should have a prasanna indriya, prasanna mana, and samagni. All these can be obtained with the help of padhyahara. But this padhyahara may become abadhya also if we have it without considering our agni bala. That is very important. Because as I told earlier, the agni, if only agni is proper, we will be able to digest padhyahara also. Otherwise, it becomes abadhya only. Why I am giving such stress in agni is because when we take the samprapti of netra roga in it is told in Ashtanga Hridayam Uttarasthana 8th chapter, while explaining the Vatma Roga Vijnaniya, the first shloka is Sarva Roga Nidanuktir Ahide Kubidamala Achakshushya Visheshena Paraya Vittanusarina Sirabhirurdam Netraveva Masudha. This story, that is the dosha dushti occurring in koshta will in turn affect the sense organs. And even I would like to quote an example. In a condition, there is a disease called amloshidam. Okay, it is a sarvakshida roga in netra, amloshidam, that is mentioned as annasaro amladam nidaha itta rektolbanair mali sirabir netra maruda karodi shyavalovidam. So it goes like that. There it is called as when our ahara we take, it undergo amla vibhaga. If not properly digested, if it undergo amla bhaga, this amlada causes pitta rekta dushti and it affects the netra. Why it is affecting the netra and not only the costas? Because at that point of time, the person might have been exposed to nidanas causing less immunity to the ocular surface. Okay. So in such a condition, he presents a disease called amloshidam, where redness of eyes, there will be severe burning sensation, there will be edema, blood vision and all. So here, the koshta and agni is directly causing the disease in the netra. So only a proper Jadaragni can help in maintenance of proper Dhatu Agni, which is important for swasthvritta. So that is why Padhyahara is important. So these are the direct references we get from Ashtanga Hridaya. The aharas usually mentioned Sarpi. Sarpi is directly Chakshushim property. Jangala Mamsam. It won't cause Kaphavritti, that is why. Then Draksha is Uttamaphala. It has also direct indication, direct indication of Chakshushim, Mamsarasam, Madhu. These all can be taken only by swastha again, not Adura. Because Mamsarasa and all cannot be taken by Adura because sometimes this Agni may be hampered. Then Shagunashana, that is specially mentioned as Netra Reksha because the mams of birds is mentioned to be good for vision. Then there are certain Mudga. Mudga means green gram, which is Meda Shleshma Rekta Pitta Jeshu Hidam. It is Rekta Pitta Hara. Then Panja Shaga, which will be mentioned later. Karavelam. Karavelam is bitter god. Actually, Karavelam, again, it is Kabhajit, Kabahara. Vartaga, a type of brinjal variety, which is Kaphavadahara. Peya Vilebi. All these are Lakhu Bhojan. Vilebi and all is direct indication to Akshiroga actually. It is Malanuloma. So proper Malakriyas and all will help in swasthvritta. Then Navamulaka, that is tender radish. It is considered to have Doshara property. It is Lakhu, Ushnam, Avyaktarasana. It is Navamulaka. Tender radish is to be taken. Then Godhumam. Prabala Prayogam should be told later. Dadima Suttama Phala in Chakshurogas. Shashtigashali. Shashtigashali is best among the Vrihi Varga, Dhanya Vargas. Saindhavam, best among the Lavana Varga. All these are Chakshushi. And Kwadita Shidala Jala. Usually it is told as rainwater is best, but we cannot use rainwater nowadays, right? Whereas Kwadita Shidala Jala, that is boiled and cooled water, it is Anabhishyanti, Lakhu, Chatoy, can be used by swastha. And these are the Dhanya Vargas. I have just classified Dhanyam, Kridana Vargam, Phalam. All these are Chakshushim. The Swastuga, Mekhanada, Punarnava, Pattura, Jivanti. These 4 are actually leafy vegetables, leaves to be used, like spinach-like varieties. And it is mentioned as all shaga are achakshushim. Apart from these 5, it is from Yoga Ratnagara, a reference is given. These 5 is considered to be best for eyes. Now, to give some few examples regarding Tribhala Prayoga. Why? Because it is considered to be the best Chakshushi or best Netra Rakshopaya. So we know Tribhala consists of Haritaki, Vikitiki and Amalaki. So when we go to the Rasa Panchakas, it is Tridosha Hara. And having Tribhala Rasayan also, proper usage of Tribhala with the Hrida and honey is considered to be Chakshushim. That yoga is very important. It is only if it is mixed Hrida and Madhu, it is Agriya for Netra. We will get Saubarnam Labade Chakshu. That is eyesight similar to eagle. We know the sharp vision of eagle. If it's sharp vision, you can see its prey at a very distance itself. Then role of Sthanyam. These are few references from scattered in different areas. Sthanyam used as Ashchodhanam in Rekta Pitta Pradhana Roga. Not Kapha Pradhana Netra Roga. Rekta Pitta Pradhana Netra Roga. Then few Padyaharas mentioned in Mukha Rogas, Yava, Mudga, Ulatham, Jangala Rasam, Karavelam, Padolam, Balamulgam, all these the dosha I have mentioned earlier. Mainly Kadu Tikta Rasa Varga should be used for Mukha Roga. That is to be mentioned Kadu Tikta Rasa. As we know, it is Kapha Pradhana Rektanubandha Sthanam. Whereas in case of Nasa Roga, it should be Kadu Amla Lavana Snigdha Oshna Prayogas. Nasa, it is mainly Kapha Pitta Rekta involvement. Nasa Roga, Kapha Pitta Dosha, Rekta involvement is mainly seen. Okay. So their usage of Kadu Amla, Lavana Snigdha Ushna Prayogas is taken to be Pathya. Here Dadi is mentioned. Why? Because Dadi is used to make Ama Pradeshyayam to Pakva Pradeshyayam, followed by Shodhana tree. For Shodhana Chikitsa, we should make Amavastha to Pakvavastha. That is why Dadi is being mentioned. All other Vartakamandra already mentioned the dosha. Shigru's Kapha Vadahara. Then Padyahara for Karna Roga. These all are the drugs. All are almost similar to drugs have been mentioned everywhere. Ahara for Shiro Roga. So moving to the Abadya Aharas. As per Netra Abadya, it is mentioned as Vidahi Vishtambagara Aharas should be avoided as it causes Rekta Dushti, which in turn causes Netra Rogas. And Netra Abadya itself is causing Abhishyandi. As no Abhishyandam is Rekta Pradhana Avastha, which will in turn cause Shodha Roda in Netra, Pitta Dushti. Similar is the case of Abadya Aharas in Shiras and Abadya Aharas in Nasa, where Viruddha Ahara is a common one mentioned. Viruddha Ahara. Why? Because the Viruddha Ahara Prayoga is similar to Vishobhama, which causes Thadu Kshaya, Thadu Nasha, and in turn Indriya Nasha. And this Jala from Sakhi and Vindhya mountains, we have a direct reference that it causes Shiro Roga. In Sutra Sthanam, Ashtanga 5th chapter, there is a direct reference. And Abhishyandi Guru Ahara should not be taken in Nasa Roga. Why? Because it increases more Kleda. And it causes more Nasa Shavana, Nasa blockage. Similarly, in case of Mukha Roga and Karna Roga, there also Viruddha Annapanam is mentioned Karna Roga, and Mukha Roga, Abhishyanda Guru, Dadi, Pura, Shira should be avoided because more prone to Kapha Rekta Pradhana diseases. Just to complete the topic, the Deva Vyabhasha Chikitsa I just added because usually chanting of Chakshu Shobhanishad and Gayatri Mantram is mentioned. Netra Rogas help to protect eyes. So we are moving into conclusion. When we mention swasthvritta, we should assess swasthvritta and should do the routine activities based on our Prakriti, Bala, Agni, Koshta and all. That is very important. And we know why it is important. Prevention is better than cure. Why? Because when we consider mostly Netra Rogas, most of the diseases are Asadhya. Most of these are Asadhya or Ayapya or Kritra Sadhya compared to the percentage of Sadhya Rogas. So there, In Yapi Rogas, the most important part is we should do Netra Raksha Pathya Kramas to maintain the disease. For example, in case of cataract, immature cataract, we know that it is not completely resolved completely without surgery. It is considered to be Kaja, taken as Kaja and Dashtika Roga, where there we should do Tikshna Anjana Prayoga in Dinacharya basis. That is important. So that prevention it is a type of prevention to arrest further progression of the disease. So as the quote says, Chakshurakshayam sarvakalam manushiyatnaha kartavyo jivide yavadicha vyartho logoayam tulyam ratra divanam pumsan nandana vidyamaya api. That is, all efforts should be made. Here it is Chakshu, just for example, for Chakshuraksha, which is one among the Pradhana Indriyas, among the others. So because for a person who's blind, both day and night will be the same, that is darkness. So we have a lot of disease, especially in netra, like retinitis pigmentosa, macular degeneration. All we know, once the retina is degenerated, we cannot regenerate it back. So in such conditions, we should undergo timely interventions and timely treatments where these Pradimarshana, Anjana and all can be made use of to arrest further progression. That is what we understand with this. So I have taken the references from Ashtanga Hridayam, Ashtanga Sangraha, Sushruta Samdhan Bhaishya Ratnavali. So before concluding, few helpful tips for present lifestyle. Some of them is eye exercises, which can be done in the case of refractive errors, eye strain, dry eye, lazy eye, and those who are IT professionals and all. There are certain eye exercises like near and far focus, and playing with the ball, which bouncing ball we just throw from one hand to other hand in a U-shaped manner and view that one. And you can rotate our eyes up without moving our head, rotate our eyes, move our eyes up and down, which help in the extraocular muscles, stimulate the extraocular muscles, right and left, diagonally. All these movements is possible. Will help to maintain our health of the eyes. Read in good illumination. Blink always. 10 to 12. You should actually blink 10 to 12 times at least once in a minute. Otherwise, usually the main cause of dry eye is we see in IT professionals is dry eye or computer vision syndrome, where they usually forget to blink. Kavala Gandusha is recommended to daily use of Pradimarshana daily, steam inhalation, breathing exercises, do Anjana once in a week, Padabhyangam and Shirabhyangam at least once a week. These are all the small tips we can do in present situation actually.